thank you for joining us for today's daily virtual media briefing on COVID-19 in London and Middlesex County. As always, we are joined today by London Mayor Ed Holder and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. And today we're also joined by the Warden of Middlesex County, Cathy Burghardt-Jesson. We welcome the folks who are tuning in today on Rogers Cable, as well as the Rogers Facebook page and on the YouTube channel, as well as those listening on Global News Radio, AM 980 CFPL, and those tuned in on the CTV London website. As always, we will continue until 2:30 this afternoon. For members of the media who are in attendance, please submit your questions in the question and answer forum, and we already have several coming in, and we are now ready to go. We appreciate your patience. We'll start with the Warden of Middlesex County, Cathy Burghardt-Jesson.
Great. Thanks so much, Jan. It's great to be with all of you today. I want to start by starting this Monday by thanking and congratulating all of our residents in Middlesex County. They've done a great job adhering to the physical distancing parameters that have been set. And as we slowly take the baby steps forward to slowly reopening everything, I really want to encourage everybody to keep those measures up. It really is paying off. I know with days like yesterday, it becomes increasingly difficult, but you know, we are seeing the results of these efforts. And I have every confidence that in the days to come, that we will find a way to our new normal. I also want to take the opportunity to shout out to our Middlesex-London paramedic services. Our paramedics have been partnering with our health unit to deliver testing throughout the city and the county. And of course, this is one of those areas that is, you know, other duties as assigned, and they've stepped up, whether it's through the community paramedicine program or through units that have been put to the testing levels. So we want to thank them and congratulate them because the testing is so important as we battle this COVID-19. And with that, I'm handing it over to Mayor Ed. Great to see you today, Ed.
And you too. Thanks very much. Appreciate that, Cathy. Ladies and gentlemen, as we know, today marks the first day of what's accurately been described as tiptoeing back to normalcy. As per the Premier's direction this past week, as of today, a number of seasonal businesses have been allowed to reopen, including garden centers that offer curbside pickup, lawn care, and landscaping companies, as well as automatic car washes. Auto dealerships can reopen by appointment, and golf courses can prepare to reopen, as well as marinas, but not allowed quite yet either to play or to boat on quite yet. So while that list is relatively small, to me it's a glimmer of hope, adding to the optimism we heard just a short time ago from the Premier that he will have more good news about further openings of business and service later this week. So we await those updates with great interest, at the same time continuing to prepare our own plans for the City of London. As always, we will be driven by data, not dates, because the health and safety of Londoners remains paramount. Second quick point, you might have noticed today that we began work on 3 essential road construction projects in the city. The reason are important because it is critical infrastructure work following the Government of Ontario's designation of certain construction projects as essential. So what have we approved and what started today? Work on Dundas Street between English and Rectory Streets and Old East Village. That includes sewer, water main, and streetscape improvements. There's also work taking place on Richmond between King and York, as well as work on Hamilton Road just east of Egerton. Now, as you would expect, the City of London is partnering with its consultants and contractors to ensure that the construction site conditions adhere to public health measures, both with the workers themselves as well as to passers-by in that area. So just to let you know what's going on, we think that's exciting and positive news for London. We're getting back to work, and we think this is all part of that broader recovery that will take what it takes, but at least this is a great start. So that's it for me. Happy to answer questions, but let's hear first from Dr. Mackie.
Thank you, Mr. Mayor and Madam Warden. I will start with the summary of our local numbers over the last 3 days. We had 4, 3, and 7 cases reported over Friday, Saturday, and Sunday, total of 14 over the weekend. About 11 of those cases were in long-term care or retirement homes. So very few cases reported recently in the general community. Provincially, we saw in the range of an average of 400 cases reported each day. That has been varying day to day, but it is definitely lower than it has been at the peak and relatively flat and or declining for the last couple of weeks. Deaths are a slightly different picture. We only had 2 over the last 3 days in Middlesex and London, but provincially, the number of deaths continues apace. 84 new deaths reported today, second highest total. I want to add a couple of things today. First of all, in response to a question from the Warden, we looked closely at the number of cases in London and Middlesex which have been reported and have resolved. In the general London area, 65% of cases have resolved, so there are only a few dozen cases continuing to be outstanding. In the Middlesex area, it's about 75% of cases, and only 9 individuals who are still considered to be active cases in the Middlesex area. The other important thing to talk about today is how important it is to physically distance when you're outdoors. It's a great time to get outdoors. The weather is turning, and we absolutely encourage people to find time to spend in nature, go out and get exercises. And you absolutely need to do that carefully. In many parts of our communities, walkways or paths are quite full, and it's absolutely crucial that people do their best to keep distancing away from others when they're in those locations. There are also amenities in and around our community outdoors that are not heavily used. So please take the time to seek those out and take measures to protect yourself and others as you do that. That's it for me today, Dan.
All right, thank you very much, Dr. Mackie. Mayor Holder, Warden Burghardt-Jesson, we do have questions ready to go, so we'll start those right away. Dr. Mackie, the first one today is for you. It's from Steve Young at CTV London. It's clear that there's a lot of pressure to reopen Ontario for business and in a safe manner. However, there's talk of a second wave of COVID-19, which could hit this summer. Dr. Mackie, what's your comfort level with the pace Canada is taking to return to normal?
So first of all, on the question of a second wave, it's quite likely that we will have a second wave of coronavirus. It doesn't seem likely, from my perspective, that would happen this summer. First of all, we've changed a lot of behavior, and even if all businesses were opened up tomorrow, the steps that people are now taking to keep themselves distanced would help keep a wave off. Second of all, we know coronavirus is a seasonal virus. If you look, Canada tests 50 to 100,000 people each year for coronavirus, even prior to the pandemic. And every year in the last 4 years, you've seen a very seasonal pattern with a peak in February, fairly flat. It does last longer than the influenza season, but it's seasonal nonetheless. And there's no reason to believe that this coronavirus would not be, to some degree, seasonal. That said, a second pandemic wave is almost certainly on the way at some point or another. So how are we doing in terms of pacing right now? I think we're actually at a pretty good pace. The places that have been opened up, for example, for urgent needs only, going out to vacation cottages for security or maintenance purposes. You've got opening up of some places essentially where you wouldn't expect a lot of people to be congregating. Garden centers as another good example. If we're doing curbside pickup at garden centers, we're really not expecting a lot of face-to-face contact. So these early steps are the right early steps. I do worry, when I look out at a park on a Sunday afternoon, as I did this Sunday, and there are hundreds of people on a path. People need to get out, people need to get exercise, but people need to keep their distance.
All right, thank you very much, Dr. Mackie. The next question is from Dan Brown at the London Free Press, and this one is for both Mayor Holder and Dr. Mackie. Police in Chatham-Kent are discouraging drive-bys during the pandemic. I'm thinking Dan means like a drive-by party or celebration. Sorry, it just disappeared on me here. Well, that is new, I guess. Here it is. It's. I think it went down to the bottom for some reason. Well, today is just one of those days. Here we go. For both the mayor and Dr. Mackie, police in Chatham-Kent are discouraging drive-bys during the pandemic, saying they violate the province's emergency order. What do you think of banning drive-bys? And by that, we mean like a drive-by birthday or celebration.
Well, maybe I'll just start with the public health risk aspect. In a situation where you have people driving by, these are things that can be done with a relatively minimal risk. If you're in your own car and you're keeping distance from the people, for example, the child's birthday, then you can do that sort of thing with pretty low risk. If it's not done carefully, the kids coming and shaking each hand as the cars drive by, or picking up a birthday gift from each person, then you do create a risk to everyone involved. That said, on top of the actual risk of the incident, there's also the message that conveys to the public that if we say that these sorts of drive-bys are okay, does that mean actually the risk of coronavirus has really disappeared, and do people misinterpret that as some kind of sign that they don't need to be careful anymore? And that's where I would be really interested in the mayor's or the warden's perspective.
Well, I'll start with mine, and then perhaps Cathy will have a perspective on this as well. From my standpoint, just this past week, I had kind of a combination walk-by, drive-by. So here I am in my car leaving City Hall, and right at Dufferin and Wellington, a friend who I've known forever sees me, and I roll down the window. He's 20 feet away. I wave hi. He's getting closer, and then he rushes the car to shake my hand. I almost ripped his fingers off by closing the automatic window because, so it's a little different perspective. But I think the point that Dr. Mackie makes is the right one. There's a tendency, because we're social people, to want to be able to press flesh, to be able to connect in whatever way. My friend got to touch the window of my driver's side, but that's as close as I got him. But that was literally, I didn't expect it. So what happens is that when drive-bys happen, things can happen that you don't expect, that encourages not just awkward, but sometimes bad behavior or non-compliant behavior, and not through fault, but just by circumstance. So risk limited, but potential challenge could be high. And don't hang around me near Dufferin and Wellington. That's the other thing I suggest as well. Perhaps the warden has some thoughts on that.
Well, thank you, Ed. I'm just echoing both what you and Dr. Mackie have said. There's something to say about these drive-bys. And what we've talked about the couple times that I've been on is the mental health aspect. I mean, just that socialization and seeing other people and the joy that it brings. I mean, that's just as important, but it has to be done safely. There's no question. Full disclosure, I have to say that I was involved in a drive-by. One of our local store owners turned 60 last week, and there was about 10 of us that got in our vehicles, and he drove around his store in the parking lot in a circle. And I have to tell you, to Ed's point, we all had our windows up, and, we honked the horns and we waved, and then we went on our way. To me, that was a safe way to celebrate a milestone in somebody's life. So I think that they can be done, but you need to be responsible. And, to the point, yes, sometimes things unexpected happen where somebody might run up and try to shake your hand. Be prepared for it. But, hopefully people will be smart as we go forward with these kinds of celebrations.
All right. Thank you all for the answers to that question. The next one is again from Dan Brown at the Free Press. Dr. Mackie, what will you be looking for in terms of case numbers to figure out if the gradual reopening, which starts today, is working or not?
Yeah.
Yeah, so we've talked on this segment a few times about the percent positivity. So I will look for both case counts and percentage positivity. And if the case counts are going up and the percent positivity is going up, that's where we really see a red flag. If it's one or the other, then we look into things and potentially collect other data, whether it's hospital visits or intensive care unit data or death data, that sort of thing. But if both are going up together, that's where I would be really concerned. I would also look for a trend over multiple days. Some people are using the 5-day moving average or the 7-day moving average. We know that even in a large province like Ontario, the numbers jump day to day fairly significantly. And so you want to be averaging out over a number of days in order to really understand what the trend is.
All right. And a follow-up question for you, Dr. Mackie, from Dan Brown. Have we reached our peak in deaths from COVID-19? What's your best sense of when the peak in deaths will arrive?
Yeah, so great question. I'll maybe actually screen share for this because there's a great website that is showing the provincial numbers. Here we go. On the left is just total deaths, which isn't particularly helpful, but on the right you've got deaths each day, and the gray line is the 5-day moving average. And so if you look at that, let's just ignore the red bars for a bit because again they bounce around day to day. But if you look at that 5-day moving average over here, the gray line over here, you can see that we have not peaked for deaths. Mm-hmm. And the only way to interpret that line is that it is still climbing. If you zoom up here to the case counts, you see that there seems to have been a peak about 10 days ago. Although, yeah, that's all we can really say there. And we know that testing has accelerated over those 10 days. So that seems like a fairly convincing peak in Ontario. The Canadian data is a little bit different, but that's what I would think is accurate for Ontario. And so, we know that in something like influenza, the peak of deaths comes about 2 weeks after the peak of cases. So if we see that death peak in another few days and then start to come down after that, then we can be very confident that we are on the backside of this epidemic wave. But that death count will be a really important number to add to our interpretation of the cases, because at this point we know that cases may or may not be changing based on the number of tests being done and who is just deciding to go get tested. So we watch very closely those two charts together, and we should know probably within a week or so whether we're absolutely certain that the peak is passed on the backside of this pandemic wave.
All right.
Now,
thank you very.
Stop my screen share.
Thank you very much, Dr. Mackie. That's great that you had that information you could share as well. Thank you for that. Dan Brown, another question. This one is for Mayor Holder. Well, it's Monday. Mayor Holder, were any fines issued over the weekend?
Well, Dan, as you know, as we all know, we had tremendous weather, but I will also tell you that enforcement was quite busy on both Saturday and Sunday. We actually issued 132 warnings to people who were having a rest on a bench, minors kicking a ball around, and parents with small children in a park. One charge was issued to an individual who scaled a fence to get onto a locked soccer field. So one charge specifically, but the concern you've got is that it's probably fair to say that when Dr. Mackie started his opening comments, he talked in terms of self-distancing and all, and that's so important in this kind of weather. But I would tell you that 132 warnings, I think our bylaw enforcement showed thoughtful restraint, which is what we look for. You hope that one warning is sufficient, but that's not insignificant as a number. So one charge laid, 132 warned. We want better weather, but we want less warnings and less tickets when we can.
Right. Thank you very much, Mayor Holder. We are going to go back to Dr. Mackie now with a question from Sophia Rodriguez from CBC London. Dr. Mackie, how is the region doing in terms of community spread? Are we out of the woods, or is it too soon to call?
So we're testing something in the range of 350 to 400 people each day in the London and Middlesex area, and we're getting a small handful of positive tests outside of long-term care in the range of 1 to 3 positives per day. So that's, I mean, clearly we're doing well, and also we still are seeing community spread of coronavirus. So let's do it. Let's finish this off. Let's get this done. Let's keep these distancing measures up for a couple more weeks, and we'll start to be able to return back to normal gradually, probably by the end of this month, and then through the summer, really starting to see things get back to normal.
Okay, we have one more question in the queue right now, waiting, and that one is from Kelly Wong at Global News Radio AM 980 CFPL, and it's for Dr. Mackie. Dr. Mackie, where would retail outlets buy masks that businesses will need to help keep their staff healthy?
Yeah, so masks can be sourced from a number of places. In normal times, you can get them from larger pharmacies, medical supply companies. You also can source them off online sources. I saw earlier today that there are some surgical masks available for delivery later this week on Amazon. So there are a number of places where those can be sourced.
All right. Well, folks, that takes us to the end of our questions. I want to thank all of you for your time today and for being part of this discussion with our local media and folks tuning in. A reminder that we will be back tomorrow afternoon at 2 o'clock with Mayor Holder and with Dr. Mackie, and Warden Burghardt-Jesson. We'll see you again real soon. Thanks for tuning in, and we'll see you tomorrow.
I want to take this opportunity to thank volunteers for their hard work and dedication. Thank you to every one of our Rogers TV volunteers, whether in front of the camera or behind the scenes. Your support means the world to us. Thank you for serving your community, and thank you for choosing Rogers TV.
Think it's okay to drive high? Think again. Drug-impaired driving is as illegal as drunk driving, and in Ontario, the penalties are the same. If police suspect you're driving under the influence of drugs of any kind, or a combination of drugs and alcohol, and you fail a roadside test, your license will be suspended immediately for up to 30 days. You'll pay a penalty of $198. And you can be charged with a criminal offense of impaired driving, the same as alcohol. Driving high is never okay.
You're watching Rogers TV.